So the purpose of this conversation is to introduce you to the benefits that come with the health insurance that Fort Hacks is offering. And in particular, what makes this, why we say that it's better and smarter, is because there's a unique relationship we have with a primary care doctor, both from an availability access and from a cost point of view. And in that, there's no cost beyond what the monthly premium is already set up at. So Dr. Sanders, if you want to take over the conversation, and I'll pick up the cost part at the later on.
Sure. So thanks for joining us, folks. I appreciate y'all taking the time, and we're all really excited about this cost-effective healthcare solution that Hal and I have put together for you all. What I want people to take away from this is that I want to be your point of contact for anything health related. Hal later in his slides is going to give you a phone number that goes right to my cell phone, and you can text me or call me anytime, including nights, weekends, if you have anything that comes up. I'd really like to be the first one to know of anything that's needed health-wise, help you make the right decisions, even if you think it's an emergency room sort of situation. Sometimes we might be able to get you taken care of in the office on a more immediate basis and avoid that higher cost bill and sitting in a waiting room with, you know, a bunch of coughing people that may or may not have COVID. So
let me jump in for just a moment and
Sure.
get more details. So why this is so important is that everyone knows who's America's most famous doctor, right? It's one of these. Right. One of those is considered the most famous, you know, the famous doctor. The reality is when somebody says, I need a doctor, where do you think people go? Where do you think the first place people go for healthcare? ER. You say ER? Family practitioner. Where do you think people go first place? Shauna, where'd you come up with? So what we found is that there's a huge number of people that go to Dr. Google.
Wikipedia, was it WebMD?
Yep, because they're trying to self-diagnose. And why would you try to self-diagnose?
Because that's what it's been done since the beginning of time, since American ancestors, American settlers. We used to know all these settlement of all these plants and what we do, everything that we're now paying fortunes for. It was done at home remedies. Great grandmother to grandfather would teach us these things. That's
Right.
all.
So it could be home remedies. It could be that we just told us some people are in the military and they were told to tough it out. So
or lack of confidence in medical profession.
okay, so all of those things are going to change.
Probably the biggest one I would argue is lack of access. They don't know how to get a hold of their doctor, or
Right.
when they do call their doctor's office, they wait on hold for 45 minutes only to be told, hey, you need to go to urgent care because we can't get you in for 2 weeks.
And I'm going to throw one more piece by you because of where you were just saying about we don't trust the system. Dr. Sanders will be the first person to tell you, you can say no to him. If he says, I think you should do A, and you say no, he's smart enough to hear you, and he's got the way to give care that says, okay, you don't believe in that? Then let's go come up with something else.
Yeah.
And at that point, instead of going to Dr. Google, because we've had to figure it out on our own and trying to find our own home remedies, we're going to move on to not Dr. Google and Nurse TikTok, but we're going to get you going to your go-to doctor. And use Scott as an example where something came up and he said, well, I don't know Dr. Sanders. And all of a sudden he did. And your experience was?
Yeah, experience was amazing. Went in, got seen. Chelsea at the front desk is amazing. Got me back to Dr. Sanders. He got me seen. Got me medicine and I was out the door. I didn't even have to stop by Kroger, Publix, none of that. Got medicine in the office. So my experience was really good. And I did not like going to doctors prior to going to Dr. Sanders. So.
And did you feel like he listened to you and it wasn't just a chop shop of in and out?
No. It felt like being seen by a family member, like somebody you know, someone you've been around for a while.
Like a family member.
Came in,
Okay.
Talked, sat down with me, made sure I was comfortable before I left out. And then even at the front desk, she said, hey, if you need anything, give us a call. So.
Okay. So you'll see the phone number here and you'll have it with you in the cards and stuff. So at this point, I'm going to turn back to Dr. Sanders and let him talk about where to come in and where not to come in.
Perfect. And thank you, Scott. I appreciate that feedback. And, you know, along those same lines, I really try to individualize care for everybody. So if you have certain preferences, goals, things that, you know, maybe are outside of the typical Western medicine approach, I would be more than happy to talk with you about those things and come up with a plan that we're all comfortable with. My take on things is I just provide guidance and recommendations and information based on, you know, what my education was and my studies, but you're the one that's got to implement any sort of plan. So if we're not on the same page, then we need to get on the same page. Otherwise, it's not really going to be very effective. The reality is my training is in family medicine. So I take care of folks from birth into old age. I've done urgent care work in the past. So, you know, lacerations, cuts that you think you might need sutures or stitches for, breathing treatments for any sort of like, you know, breathing or asthma concerns, you know, joint injections for joint pains or getting x-rays. You know, some of these basic things I'm more than capable and happy to help with and make sure we get a cost-effective plan together. Sometimes bigger things occur. A scenario where someone is sick enough to really need to be in the hospital or needs to see a specialist. And that's where Hal comes in and has really put a solution together where people aren't left in an awkward position of, I can't really help people get the answer. And now they, you know, maybe in a really tough spot financially, you know, getting the right treatment that they need. So I think that's kind of more the slide that you have there, Hal, right? Is there are things we do. We draw blood. We, you know, can make any sort of basic labs very affordable, if not even run through your insurance for free. There's no charge for you to ever come into the office or reach out to me for any sort of medical needs or questions. It's all part of your current health plan. Absolutely no extra cost. But beyond that, when things do get more complicated or specialized, that's when Hal's put a really nice solution together for you.
And in that mind, we'll talk about that on the next slide. To point out though, Dr. Sanders should be the first person to go to, because when you look at medications, there's so many different prices for the same medication. Dr. Sanders knows all these things. So he'll be able to say, he may have some of them in his office right then, which are gonna be cheaper, or he can help you to figure out what's the right thing. So
Absolutely.
I've been amazed how much he knows about, and we have the conversation. It's about your mental health, it's about your physical health, your mental health, and your financial health.
Yeah.
And so
it's always good to be able to choose what medication you want to take and put in your body and have that choice instead of going to most primary doctors where you're gave a prescription, you're going.
And I've actually seen primary care doctors that are not like Dr. Sanders who will write a script and they'll put the brand name down because that's what they were trained on. It's this medication. And they forget to say, or generic.
Yeah, there's no thought of cost to you at all.
No. Yeah. Okay. So this is a detail of the plan, and you have a copy of it, or we can get copies of it because it's all little type. What's important here, and Dr. Sanders knows this well, so he's already on your side. There's in-network and out-of-network doctors. So we are using the Cigna network. So it is a large network, and you can call the phone number on your card to make sure that they cover it. Hospitals in the state of Georgia, no problem. Hospitals throughout the country, no problem. Shouldn't be a problem. Emergencies, everything is considered in network. So if there's an emergency and you get rushed to the hospital or you rush yourself to the hospital, no problem. But if it's anything elective, you do want to take a few minutes, make sure it's in network. The rest of the stuff we can go through in details if you have any questions.
And if you aren't sure if it's an emergency, I mean, you know, if someone's unconscious, that's a 911 call. But if it's something where you're just not sure where to get care, but you know you need immediate care, that's when you call me. And again, we'll have the phone number at the end of this presentation.
And And as we look at this, again, trying to compare when do you use Dr. Sanders and when does the insurance plan pay? You'll see primary care visits and teledoc. So you're gonna have a cell phone number. Dr. Sanders tells a story about somebody going to the hospital. They were out working in the yard, they got bit by a snake. I don't know about you, when you get bit by a snake, that would kind of scare, especially when they have those triangular type heads. They're like, okay, this is a bad
Possible
thing.
poison.
Right. So I don't know. So I'm going to go let the doctor figure that out. Somebody like Dr. Sanders knows that, okay, well, you're not sure if it was a poisonous snake or not. But by the way, big snake or little snake? And the snake was this 4-foot snake. It was under law. Well, people like Dr. Sanders know that big snakes don't really try to kill humans. It's only the little babies who don't control their venom that are the dangerous ones. So in this case, it was, okay, don't go to the hospital. Don't spend $1,500 for a copay or whatever, and don't spend 3 hours with other sick people, but go home and here's the kind of things that Dr. Sanders will have you watch for to determine if there's something worth pursuing. So again, this slide is showing you where to make decisions. Do you need urgent care? If it's a stitch and Dr. Sanders is near enough to you, then go to him and get the stitches. If you happen to be in Florida or Texas, probably not worth coming back for stitches, but in that case, urgent care, you can see that if it's in network versus out of network, it's going to be a lot less expensive. Most of the Trustmark insurance gives, and it's interesting, Trustmark is the insurance. They are the money. They are the ones that are regulated by the state of Georgia. But Cigna is the company who has created the network. It's the name you've probably heard of. So it's the Cigna network of providers and hospitals. It is Trustmark who is writing the checks. And as we move on to, this is pretty much the last slide, and then we open it up for questions. You'll also notice that Dr. Sanders has a sense of humor.
Oh, definitely.
Which to me shows a good sign of a doctor. So Dr. Sanders, I'll let you, any comments you want to add to this about you are the first call?
No, I think that's great. I mean, I just would highly encourage and I would appreciate that folks, take that seriously, because it does kind of frustrate and upset me a little bit when I find out someone went to an emergency room for a non-emergency issue, and I can help you make that decision. And 9 times out of 10, we can probably get you taken care of in our office for essentially no cost.
Anybody have any questions about what if this happens or what if that happens?
Hey, how are you, sir?
Okay.
Dr. Sanders, where are you at, sir?
Where's he located? I'll show you that. I'll just change slides here for a second. So Log Cabin Drive is Paces Ferry.
Okay.
So just west of 75. And he's literally a block inside the highway. You see it right there.
Yeah. So it's kind of the Smyrna Vinings area. But that being said, I mean, even if so say you're in Texas or, out on another job, even then that phone number that you have goes right to me. And during office hours, it goes into our office. So don't worry that, that's the wrong number to call. That's the only one you need to save. I can call things into Texas. I can help you decide, hey, is this something that you really do need to be seen, or let's try something first. And if you're really not getting better, well, sure, there is a role for urgent care. If you're, 800 miles away, that's kind of tough to get in, right? But even anyway, say you're sick, you can't get in on Monday. Let's talk through the plan of action. Let's get some things kind of called in for you. Here's when I do really need to see you urgently. If you're not better, let's make a plan to get you in on Thursday when it's more convenient for you. I do that all the time with folks. And it's really, what Hal and I have put together for you all. It breaks down all the barriers to accessing the physician that you know and trust.
Other questions?
I got one question, and it's more for me personally, because all of us have different situations, but do you accept TRICARE?
We'll talk about that afterward because there's some complexities, but as far as for him,
Right.
you just go. And then And then instead of writing a prescription or a test that would be paid for by Trustmark, we're gonna have TRICARE pay for it.
TRICARE being a primary, Trustmark being a secondary.
You wouldn't even need Trustmark.
Okay, okay.
Yeah.
And then third, in a couple of years, I'll be in that Medicare thing. I don't understand it. We'll be able to guide through, those of us that go to Medicare will be able to guide us through that network of marketing that everybody throws out.
Yes, we'll walk you through that. And I would still tell you that having Dr. Sanders is a godsend for access and such.
Yeah, we have patients that come here that have TRICARE, Medicare, Cigna. I don't know about Trustmark until now because it's a slightly different health insurance solution, but you name it. And then I have a number of folks that have no insurance. They all get the exact same level of care here. The insurance part does not make a big difference. What I really try to do is help people navigate their insurance so they know here's when you should use it, here's when you shouldn't. But that's something Hal and I have really talked through to make sure that we use the Trustmark to people's best advantage.
And the real key here is that because of the relationship we have with Dr. Sanders, where we refer to it as a monthly membership.
Mhm.
So the premium that you pay includes a fee for his membership. He doesn't need the large staff, the large panel of patients to keep seeing people real quick. So he can spend the time discussing the financial impact as well as the physical or mental. All right, with that, we know who to call. Here's my contact information. If you have insurance questions, the real part is that you want to be talking to Dr. Sanders. And with that, we're going to wrap up the recording.
Perfect. So everybody store that number in their phone with my name, just so you know who to call. Because, you know, when something comes up, you kind of get in a frantic. And unfortunately, we all know the 911 number too well.
Thanks, Dr. Sanders.
Thanks, sir.
All right. Thanks, everyone.
All right, the recording's all stopped.
Good
So,
weekend.
Brian, anything else you want to bring up? The recording has been stopped, so we now have that 20 minutes of your presentation and the questions from this group as, let's refer to them as random questions.
Yeah, I mean, I'm a open book. So if folks have any questions, I'd love to answer them. Otherwise, one thing we didn't put in the video, but Scott and the folks with us, if you guys could really help us pass this message along, if people can try and get in just to kind of
One time, the first,
meet me, make sure we're all on the same page, you know, get your basic health history down, just so that when a more urgent issue does come up, I can really properly, you know, take care of you and not have to, you know, run through 15 minutes of questions. That would be my preference, but I know it's tough.
How do we do that? We call in and give information, or we just come in for an initial visit?
no, you go in.
I'll just go on in for an
So-
initial visit and.
So there's
get
an
set up.
annual exam and there's a women's wellness exam, and Dr. Sanders can do both,
Really?
right?
Yeah, we do a lot of preventative care, and
Good.
my background, I can do pap smears, I can help people set up their mammograms. I mean, we can do a lot of that basic women's health care.
Well, good, because what's interesting is a lot of women will use their gynecologist for primary care. And you can hear the insurance company say, yes, you can go to a gynecologist for your primary care visit. They just said primary care, which is what Dr. Sanders does. So what we both will encourage people is use a gynecologist as a specialist. If there's something abnormal, that's what Dr. Sanders knows when to send people to different people.
To the OBGYN.
When there's something abnormal. But if it's normal, why pay for a specialist? And why also be limited to what that specialist knows versus Dr. Sanders has the wide view of things. All right. Well, thank you for your time.
Perfect.
Hopefully
Any
we'll
other
do it in person
questions,
next
or-
time. We're good.
Thanks, sir. Appreciate you, Doctor.
Thanks.
All right,
Bye.
thank you. Nice to meet you all. Thanks, Hal.
See you, Brian.
Appreciate it.